So you're here to find out about the implications of CCSVI and multiple sclerosis. CCSVI is chronic cerebrospinal venous insufficiency. What it really is, in theory, is blockages in the jugular veins at the base of the neck or the azygous vein that drains the spinal cord. And the theory is that if the emptying of the blood is delayed, that can cause the red blood cells to have more of a chance to migrate out into the brain matter. And once they cross the blood-brain barrier, they really can't move anymore, and they are stagnant. Once they are stagnant, the red blood cells die, and what's left behind is hemosiderin. And it is possible that it's the hemosiderin that can start the whole reaction or the response that could lead to the autoimmunity or the inflammatory response that can cause or be one of the causative agents for development of the MS plaques. So what can you do if you have multiple sclerosis and you're concerned about CCSVI? I think there are some very simple tests that can be done. An ultrasound of the jugular veins can identify whether you have stenosis and or reflux within the jugular veins. Although the ultrasound is not definitive, and in our experience, maybe it has an accuracy of 60 or 70% in finding out whether you have these blockages and reflux, the venogram truly is the diagnostic test. And in experiences that have been reported worldwide tell us that patients that have central venous stenosis, narrowing in the jugular veins, tend to have delayed emptying of the jugular veins. They also tend to have a narrowing that is very obvious on the venogram. If you treat these patients before and after treatment, you can see significant clinical improvement in patients. And this is what has been reported in the literature today. Unfortunately, to date, there have been no randomized trials that randomize a normal subject to a patient with multiple sclerosis and treat them both to see if there is a benefit. There are some ongoing clinical trials that are looking at just that, but these studies are just at the inception, and by the time we figure out what the results are is going to be sometime down the road. So let's talk about the procedure for CCSVI. Once you've had your ultrasound done and there is a suggestion or an indication that tells us that there's blockage in the jugular veins, you go on to have a venogram. And a venogram is simply using an X-ray and some contrast, exploring the veins within the body to understand what the veins look like from inside out. What we essentially do is lie you down on a table. You get conscious sedation, so you're very comfortable, and the conscious sedation comes in through an IV that's put in your arm. Once the conscious sedation is started, we infiltrate a little bit of local anesthetic at your groin crease. That's where the femoral vein is. We enter the femoral vein by percutaneous means with a tiny needle. We pass a catheter through your veins, marching up from the inferior vena cava, which is the vein that empties your lower half of the body into your lungs and into your heart, and go through the back of your heart up into your right as well as the left jugular vein and the azygous vein, which wraps behind the heart and drains the spinal cord. Once we get into these veins, we take images which tell us if there are any blockages within the veins. The treatment for this is simple venoplasty, and what that means is we take a balloon sized appropriately to the vein that has a narrowing, and we dilate the balloon. By opening the balloon, it adds compression on the walls of the veins, and whatever strictures there are open up with the balloon. Generally, the success rate of this is pretty good, and the nature of this procedure is really minimally invasive. The implications of CCSVI and multiple sclerosis certainly is a controversial area today. The reason it's controversial is because we really don't have any randomized data. What that means is evidence that compares normal subjects to patients with multiple sclerosis that both get treatment to tell us that multiple sclerosis patients truly benefit from venoplasty. But not everything we do needs randomized data to make sense. And the evidence that does exist is moving the pendulum in a direction that's telling us that there's something here, whether it is a valvular dysfunction, and there are these valves at the base of the neck. And what valves really do is they control the output of blood from the brain into the superior vena cava and back towards the heart. And the valves are really shaped like leaflets. So when the blood's going to empty, the valves open. And when the blood is not to go back and reflux up into the brain, the valves shut. And this prevents the blood from re-entering the brain. And when the brain blood needs to empty again, the valves open. What we're finding is that in multiple sclerosis patients, these valves might not be functioning properly. And instead of opening and closing, they might just stay open. And they might be scarring that causes this stricture. And that is what we are noticing as a primary modality where the strictures are found. What we're also learning is that certain subset of patients, particularly those with relapse remitting, tend to have clinical improvement after treatment. Again, I think it's way too early for us to cast any long-term implications or judgments as to where this is going to go. But there are a few things that are clear, and that is that I think there is something here in the evidence that exists, number one. Number two, that this will require a multidisciplinary effort on the part of neurologists, interventionalists, vascular surgeons, and a whole gamut of people that are involved in managing multiple sclerosis patients to really piece this together. And this will also require efforts on the part of national societies as well as international societies to really have an impact on research in multiple sclerosis and CCSVI.